Welcome back to the Morning Blend. Well, sleep apnea sufferers know the gold standard for care is the CPAP machine, a mask that you wear at night that forces air into your system. It's supposed to treat this common sleep problem and give you a good night's rest.
Yeah, but what if it's not working for you? Dr. Madan Kandula is with the Snoring Center at Advent with more. Welcome back, Dr. Kandula.
Thank you. Thank you.
Well, I think this is a big issue. Everybody knows that the CPAP is, like Molly said, the gold standard. It's what you want to use if you have sleep apnea because we know it works well, but a lot of people can't tolerate it. Why is that?
Yeah, I mean, it depends on somebody's issues, but what happens when somebody has sleep apnea is that the back of the throat closes down when they're trying to sleep at night. And so instead of breathing normally, breathing optimally when they're sleeping at night, they're getting strangled. Typically, to have sleep apnea, you have to have at least 15 to 20 episodes per hour where they're stopping breathing at night.
That's
a lot of folks have that 40, 50, 60, 100, 120 per hour. And you can imagine, so if somebody's walking in your room and strangling you every minute, more than once a minute, it's not comfortable. So the issue happens in the back of the throat. The back of the throat is not working properly. The CPAP machine is trying to keep that area open, so it's trying to push air in to keep that area open.
The CPAP machine has been considered sort of the gold standard. Like if you're diagnosed with sleep apnea, then you're going to need the CPAP machine to wear at night. Why is it that that's sort of considered the best treatment for sleep apnea?
It's been proven to work. So it's been proven to work when it works for somebody, but a lot of folks get stuck in this trap where they know they got sleep apnea, they've been diagnosed, they've been given a machine or kind of thrown a machine at them and said, hey, this is what you need to do, and that's all the end of the story, and they expect that that patient's going to go and do the right thing. It's not natural, so it's something foreign you're bringing in to your bedroom and you're sleeping with it at night, and if it's working for you, that's great, but a lot of folks are apprehensive with it, and then when they put it on and it's supposed to work for them, they feel like they're strangling. And a lot of those folks who feel like they're strangling are having a dual issue where the back of the throat isn't working and their nose doesn't work. And so all of a sudden, if you put a mask on your mouth and your nose and you say, go to sleep with that, it feels like, literally you're going to strangle. And a lot of folks just tear it off and say, yeah, I know I'm supposed to do this, but this is the worst thing I've ever tried. And that's not right. And then they get they sort of get frustrated where, yeah, I know what I need to do. I can't do this machine, and they don't know what to do next.
So the issue really is in the nose, some of it too, for the people who oftentimes don't like the way it feels. Can it be that it's because they're having nasal obstruction? Is that why?
Yeah, so it's really a separate issue. So it's kind of, it gets confusing, but the apnea is happening in the back of the throat. If somebody's nose isn't working, a lot of folks don't know that their nose isn't working. They've always had a nose that doesn't work, and they just don't know that that's an issue. And so if somebody's having issues with tolerating a CPAP machine, a lot of times it's as simple as looking in the nose, fixing the nose. We have lots of things we can do nowadays, simple things in the office, surgeries if folks need that. And a lot of times if we can fix the nose, then all of a sudden the machine it's their friend. It's working for them, things are good, and we're moving on from there.
So the point is then that if the CPAP machine, some people maybe think, oh, it's just not comfortable for me, or I just can't wear it for whatever reason, and maybe there's something anatomical going on where if they got that fixed up, it might be very comfortable for them and might ultimately solve their problem with sleep. Because there's some dangers with not getting a good night's rest, but then also if you're not breathing for seconds or whatever over the course of an evening every time you fall asleep, that's a problem.
Yeah, it's a problem day in, day out. So it's actually worse if somebody's tired and they're getting on the road than if you have a couple of drinks and get on the road. And somebody's tired on a persistent, consistent basis every day of their life, they're getting dragged down, which is not good. Then there's also repercussions of not treating your sleep apnea. So if you're not treating your sleep apnea, all of a sudden your risk of heart attacks and strokes goes up 6 times what it normally would be. Your risk of diabetes goes up, high blood pressure, everything. Your body is, when you're trying to sleep at night, your body is all of a sudden getting strangled, and so it's a stressful encounter instead of being something that's helping your body.
So people can come in, they can do a test with you, right? And if they're having issues, whether they already know they have sleep apnea or not, they can still come to you?
Yeah, absolutely. So if you just snore, you think you might have trouble, then there's a real easy home sleep study that can be done to figure out whether you have sleep apnea, whether you just snore, what the issue is. On the flip side is, just being able to look in there and see what's going on. If somebody's got a nasal blockage, we can figure that out and we can correct that. there are procedures that can be done in the back of the throat to help for folks who have milder forms of sleep apnea. So maybe the machine isn't the right fit for you. Maybe your nose is working, but there's some options. There's always going to be an option that's going to help our cause if somebody's got severe or significant issues.
Are some of the procedures that you're talking about, including the in-office procedures, ever covered by insurance?
Yeah, most of the time. So most of the time, especially when we're coming after the nose, almost always those things are going to be covered as far as insurance goes.
So what do you think is the first step? I mean, if someone out there is saying either their significant other or themselves, they think they're really tired every day, or they know their significant other snores, or they've been told that they snore, what's something they should do just to start the process?
It's simple, getting it checked out. And it sounds simple. I think if for folks who've never gotten it checked out, coming in, getting it checked out, we'll be able to do a thorough evaluation to figure out what needs to happen. If somebody's had a diagnosis or gone down the road of having a sleep study and maybe even trying a machine and it hasn't worked for them, then absolutely getting in and getting it checked out, because that's not the end of the road. There's many other pathways that we can go down, above and beyond that.
And don't give up on
It's
treatment, I
important.
think, is the key. And there's an in-home testing procedure to diagnose sleep problems too. And you can find out more by visiting the Snoring Center at Advent, Advanced Ear, Nose, and Throat Specialists. They're located on North Mayfair Road in Wauwatosa. To schedule an appointment and find out more about the in-home testing, you can call 414-771-6780 or go to advent.md. Nice to have you on the show.
Thanks,
Thank you.
Doctor.
Thank you very much.